So I am really interested in the trial of a new approach to hand transplants, one that dramatically cuts the amount of anti-rejection drugs a patient needs to take. The trial involves both military and civilian patients. And I've come to meet one of the first participants. Chris Pollock lost both hands in a farming accident. Can you feel that?
I can feel that, yeah.
Is that sensation? Was sensation a big reason why?
Oh, yes. I mean, with hooks, you don't feel anything. You just, you kind of had to guess at everything. Now, I mean, you pick things up and you don't even realize you're doing it.
There's something really extraordinary about the idea that this was once on somebody else.
It is really exciting, I think.
Yes. Can I sort of see you in action then?
Sure. Would you like some eggs?
That would be lovely. Chris had a double hand transplant in February 2010.
Okay, here we go. Well, sorry, Michael. You're going to have scrambled eggs.
I'll go for scrambled eggs. I like scrambled eggs. I prefer
put
scrambled
these in
eggs.
the tray.
Worldwide, over 30 people have had hand transplants. Normally, however, they take large numbers of harmful anti-rejection drugs. Very good.
Thank you.
So what level of drugs are you taking at the moment?
I'm only taking one anti-rejection medicine.
Would you have done it, do you think, otherwise?
No, because I did have some information given to me right after my accident, and I read about it, and it was like 4 or 5 different medicines. I was like, I don't want, I'm already on enough. And really, what sold me is the one medicine, having one medicine.
Do you think them as your hands now?
Yes, I do.
I was nervous when Chris offered to drive me to his physiotherapist, but he was in complete control. Do you know anything much about donor?
I often wonder to myself, well, I wonder what that person did, but it's short-lived. I don't think about it, ponder on it for ages. I just, kind of think about it for a minute or two, and then I'm on to the next thing.
It is. So this is your sort of second home, is it?
It is.
You spend so much time.
Yes.
Chris is still learning how to use his new hands.
And that's improved with the small muscles working so much better.
Okay. Is that just sort of rolling them around? Is that what you're doing? Yeah.
Right.
And has there been a lot of improvement?
Just even in 6 months, I see a difference.
Chris's own nerves are slowly growing into the new hands.
So I ask him to close his eyes, and I touch a finger. This is difficult.
Yeah,
He knows he's being touched, but he can't always tell you which digit's being touched.
Yes. So I just do this, and what's your immediate thought?
I can tell you're touching me, but I just can't tell which finger.
Right, and when I do this, can you...
My thumb.
But when I just squeeze?
Right. It feels like you're squeezing my middle finger.
It feels
Even
like
though it's
I'm
mine.
actually squeezing your thumb, but it feels like your middle finger.
Yeah, exactly.
Right, yes. I enjoyed meeting Chris, and I was really impressed by what he can do with his hands, or at least with somebody else's hands. And now I want to find out how his medical team were able to cut his anti-rejection drugs down to just one. Chris had his operation in Pittsburgh, and I've come here to meet Dr. Lossi, who is overseeing the transplant trial and was part of the original surgical team. Chris was a very good match, I have to say. I mean, I kind of looked at it and I thought, oh, yeah. So I guess that's the most fascinating thing about what you guys are doing at the moment, is the fact that the amount of immunosuppression you have to take is so massively reduced. So what do you actually do?
On the day of transplantation, the patient is given a rather significant immunosuppressant, and it really turns down your immune system. And you're then given the donor's arm.
The hand is basically attached.
It's attached. And on the next day, you're started with a single drug. You're given 2 weeks later the donor's bone marrow.
This is a donor hand being removed. Wow. I have never seen anything like this before. I've seen hands being attached. I've never seen a hand being detached, if you like, from a dead person. With Dr. Lossey's procedure, they also remove bone marrow, which contains the donor's immune cells.
The second team, our team, stays behind, closes up the donor site,
yeah.
and then retrieves the vertebral bodies and takes out the...
So you take the spine, you separate the spine out from the dead
Yes.
person, and you basically mince that, do you, to retrieve the bone marrow. It's quite gruesome when you think about it, isn't it? 2 weeks later, the marrow is injected into the donor. What happens next is still being researched.
So you're infused an IV infusion of what looks to be a blood transfusion of the donor's bone marrow, and somehow, this is all theoretical, it's felt to help re-educate the immune system so that it tolerates the donated arm.
It's thought that immune cells from the donor's bone marrow alter the recipient's immune system, so it no longer aggressively attacks the new arm. I must admit, I find it extraordinary how much it has changed in such a short period of time. And this really is an area which is kind of rocketing, isn't it? There's huge need.
Right.
Because you just go to places like Afghanistan and you see all these young men with their bits blown off, and you can absolutely see why you would want to have a transplant program available.
And the military's been very supportive, and that's how many of the programs function here.